Hey, it's Anna, and today let's talk about this confusing topic of 10-year moratorium in Australia and how to scale it and how it affects you as a doctor working in Australia. So in Australia, we use Medicare, and Medicare is used. It's by patients to access services, and some services are deemed as Medicare rebatable services, meaning Medicare is able, a patient can pay some service for a certain service, and then Medicare reimburses part of the payment to them. This is usually, Medicare services are usually provided either by general practitioners or are provided by specialists in various, locations. So essentially, the 10-year moratorium limits either international medical graduates or foreign graduates from various countries that are registered in Australia. And this is just, I feel, a way to allow the workforce to reach the people that need it the most, so more rurally, more regional places and stuff like that. And I've always said in Australia is very large, it's very vast. And of course, the major towns are considered metro. And then, of course, they are outer metro places. And then there is the regional places. And then there's the remote locations of Australia. So there is a classification called the modified Monash classification, so MM1 to MM5, and of course 5 being the most remote places, and 1 being the urban sort of really metropolitan places, so around the major cities. So if you've trained overseas, if you work in hospital, that's fine. That may not directly affect you, especially as you will not be billing personally. You'll not be billing for Medicare rebatable services. Of course, unless you're working in emergency department where you're billing directly as patients, especially if you're working in a private emergency department where they bill privately. Okay, so how does this affect you? Like, say you're coming to Australia in the year 2025, how's this 10-year moratorium going to affect you, and what does it mean for you as somebody that's starting to work in Australia? So essentially, when you apply for your registration with APRA and you have trained outside Australia or outside New Zealand, either you'll be an international medical graduate, and then of course there are foreign graduates, like people that have even the people that have trained locally here in Australia or New Zealand, but they were not permanent residents or citizens at the time of enrolling in the program, are classified as foreign doctors as well. So essentially, when you register, the first day that you register, from that day, say you register on the 25th of July 2025, your moratorium ideally is supposed to end on the same day, but in 2035. Okay, so that means if you got a job that required you to bill the patient directly, you would not bill unless you are in an area where you had what we call 19AB exemption, meaning either you were working in MM2 and above. Okay, so depending on where you're working, for every place that you work, you need to apply for something called a provider number, which is specific to the site that you're working at. And when you get that provider number, for you to get that provider number, you need to meet this requirement, depending, again, like I said, depending on whether you'll be billing patients Medicare rebatable services. So if you've applied for a provider number before, you will notice that there's a place where they ask you what you will be doing in that specific site. So if your job is just to refer, then like you see, like a hospital intern, hospital RMO registrar and stuff like that, then you are fine. You will still get, your provider number. But if you are billing Medicare or DVA, that's Department of Veteran Affairs, then you will need to meet that, requirements, that 19AB exemption, meaning you will need to be able to say, the location that you're at is outer, metro, like MM2 and above, or that either because of a spouse, you can get what we call spousal exemption for 19AB. So in short, if you are a specialist, either a GP specialist or a non-GP specialist in whatever area that you are, you will be affected by this. So you will be limited to working as a GP in a district of priority area if you're specialized, or if you are a non-GP specialist in a district of work shortage. So it just depends on where you're at, and there's a calendar there, not a calendar, a map that can show you if that specific area is a DWS or a DPA area. Okay, so someone may be asking also, can I reduce this period of time? And the answer is yes. And that is what we call scaling up. You can scale that time that you are on the moratorium by various ways. Number one, if you, depending on where you are placed, there is an amount of time that you can be taken away from that moratorium, with the highest amount of time, like even 50% can be taken off your 10-year moratorium if you work in an area like MM5, which is actually quite remote areas where sometimes you may find yourself, probably you're the only doctor and stuff like that. So yes, you can reduce that amount of time, and yes, sometimes you can get exemptions, and that is a whole topic that I may be able to cover in a different video. So that's it for the moratorium. Straightforward, 10 years from the date that you're registered. Even if you took a break, say you took a break and went to have kids and stuff like that, and you're out of work for, like, let's say 4 or 5 years raising the kids, and then you are re-entering the clinical area, your moratorium will still end 10 years from the date that you got registered. And that, in that way, then you don't have to be restricted to the area that you work. You can easily now work in, urban, metro areas. And stuff like that. And again, I'm reinforcing, if your role is just to refer, like a hospital intern, hospital doctor, then again, you'll still be able to get your registration. You'll still be able to work in an urban hospital. So that's it about the moratorium. If it still is confusing, do let me know. Put up comments there and ask, and I will endeavor to answer them to the best of my ability. Thank you so much for keeping it here and for always using the content that I put out. And remember to subscribe, share if this has been helpful to you. Thank you so much.